Your body just won't cooperate. Your legs feel like lead, your hands shake, or your speech slurs, but every scan and test comes back normal. You're not imagining it, and it's not all in your head. This is functional neurological disorder, or FND, a condition that scrambles the brain's wiring, much like a glitch in a computer. And for those with traumatic brain injuries, TBIs, post-concussion syndrome, or even possible early signs of chronic traumatic encephalopathy, CTE, FND can be a frustrating and often overlooked piece of the puzzle. FND is when the brain has trouble sending and receiving messages correctly, causing real physical and neurological symptoms like tremors, weakness, seizures, or even temporary paralysis. Unlike structural damage from a stroke or a tumor, FND is about function, meaning the brain is misfiring but not necessarily broken. This makes it tricky to diagnose, especially when a patient has a history of head trauma. The connection to TBIs and post-concussion syndrome TBIs, whether from a car accident, sports injury, or military service, can trigger FND because they disrupt normal brain pathways. Some patients recover from a concussion in weeks, while others develop chronic symptoms like brain fog, dizziness, or movement issues. This is where things get complicated. Is it lingering effects of the TBI? Post-concussion syndrome? Or is it FND developing alongside these conditions? Often, it's a mix of all three. Currently, FND affects approximately 50 to 140 individuals per 100,000, translating to an estimated 165,000 to 462,000 people nationwide. Here's where it gets even more interesting. FND shares a close relationship with PTSD and other trauma-related disorders. Many patients with FND have experienced physical trauma, emotional trauma, or both. In veterans, for example, TBIs and PTSD often go hand in hand. The brain, under repeated stress, can start misfiring, creating real neurological symptoms that don't always match up with traditional medical explanations. This overlap makes it difficult for neuropsychologists to untangle whether symptoms are coming from physical brain damage, emotional distress, or both. CTE, the degenerative brain disease seen in athletes and veterans with repeated head injuries, is still being studied. But there's reason to believe that some early symptoms, like mood changes, memory issues, and movement disorders, could overlap with FND. Since CTE is only diagnosed after death, patients often go years without clear answers, leaving FND as a possible explanation for their struggles. If you or a loved one has experienced head trauma and now battles unexplained neurological symptoms, know this: you are not alone, and you are not imagining it. FND is real, and while it's complex, there is hope. Rehabilitation, therapy, and retraining the brain can help improve function over time. The key is awareness, both for patients and caregivers, so that those suffering aren't dismissed, but instead supported on their road to recovery. Please like and subscribe for more content like this. Here at Robin's Nest Alliance, we are here for you because we are both the affected and the caregiver,